Good morning. Now, white people in England and Wales have had significantly elevated overall mortality rates compared with other ethnic groups before the pandemic hit. That's according to figures from the ONS, or Office of National Statistics.
Yeah, the white ethnic group had a higher mortality rate of causes of death, such as dementia and common cancers, compared to most other ethnicities from 2017 through to 2019. Other ethnicities did, however, have higher mortality rates for causes of death, such as heart disease and diabetes. The ONS has said the reasons behind the findings are complex and differ by cause of death.
GBNews' Inaya Folarin Iman has been investigating these figures and joins us live this morning. Inaya, good morning. You're looking fabulous, by the way. Now, how big is the gap in mortality rate between white ethnic groups and others?
So it is quite large, and it is interesting because this is embedded in a situation over the last 18 months where we have had a conversation about COVID-19 and the disproportionate impact that COVID-19 has had on ethnic minority groups in particular. So these figures are related to pre-pandemic, but it has found, the Office of National Statistics, that the overall mortality rate for white British ethnic groups is actually higher than other ethnic minority populations. And then, as you rightfully mentioned in the introduction, for some types of cancers, but also dementia. And that just demonstrates this disparity. When you look into the figures, it's quite interesting. There's a complex range of reasons for that. So we know class, we know intergenerational housing, we know lifestyle, exposure to smoking. There's many different factors, and what these statistics are trying to do is illuminate that there are a complex range of reasons for the way in which there are different health outcomes. And actually, earlier this year, the Commission for Racial and Ethnic Disparities, the CRED report, actually called for an Office for Health Disparities in order to look at why there are such disparities in health outcomes between different ethnic groups, instead of kind of jumping to the reason for race as to the reason why there are different disparities.
Yeah, I was going to say, because it seems that what they're saying is, oh, hang on a minute, the fact that people are sick has got nothing to do really with the colour of their skin, but more their environment and how they live, which to me is totally, completely obvious. And I remember at the beginning of the pandemic, the way they sort of jumped on this whole thing that all black people are more likely to get COVID or to die from COVID, when actually it was more to do with environmental factors and how close you are in contact with the disease.
Yeah, exactly. So, for example, profession was a big reason for that. So just as some ethnic minority groups are more likely to work in close contact, such as taxi drivers, just as likely, for example, Indian ethnic groups are more likely to work in professional professions, such as being a doctor. So there was quite a wide range of reasons why someone might be exposed to COVID-19. For example, also, some ethnic minority groups, particularly Black Caribbean, have higher rates of diabetes, and some of that's to do with diet. Exactly. So I think that it is interesting that when you look at these statistics, you find that it's much more complex, much more nuanced, and I think the picture that we've been painting.
When I look at, just looking at this one, says that, you know, the causes for death are dementia and common cancers. You could say that those are diseases associated with much older people. Is it the case that white people live longer, and thus actually the diseases they're dying of are diseases that affect
the other way
older
around.
people?
It's the other way around. Black people live longer.
Yeah, it's actually quite interesting. But I think you do raise an important point about the fact that actually ethnic minority populations have a younger, on average, age group than actually white British population, and that's, again, complex range of reasons, such as waves of immigration and things like that. So actually, when you look at those statistics, it's much, much, much more complicated. And I think that it is important that the Office of National Statistics is trying to illuminate all of the different reasons rather than focusing on one single reason to understand the problems.
That's good, isn't it? I think it's about time we stop sort of looking at colour as the first narrative and start looking at the environmental factors and other factors that will affect your prognosis in life.
And I do hope that at some point, as a society, we get to a stage where we don't necessarily have to think of everything through the lens of race, because sometimes when we have these statistics, it's almost like it's a competition. Well, actually, white people live longer or don't live longer, or white people have this disease and not disease. Actually, thinking about things always in that type of lens doesn't always illuminate all of the different reasons why different disparities exist, particularly in relation to health.
Well, we're all interlinked. We are all one people. Anaya, thank you so much for joining us.
Thanks very much indeed.